Hello, everyone, and welcome to this meeting of the West Michigan Sustainable Business Forum. I hope everyone got some nice lunch from Daddy Pete's Barbecue, which looks to be delicious. And I'm Steve Asarian. I am the business librarian here at the library, and there are a few services that we offer that I think that y'all should know about. So first, we do consultations in 3 areas: job seeking, business development, and entrepreneurship, as well as nonprofit grant seeking. So if you do have any needs in those areas, you can just either call us here at the library or email me at businesslibrarian@grpl.org. And consultations are an hour of my time, and it's pretty much whatever your information needs might be. And as a business librarian, I'm really happy that we can kind of provide that service, and I'm really happy to work with anybody who needs that kind of information. So there's that to mention. And then for us, in terms of our career, one thing that we all kind of understand is that none of us can really stop learning. And if you'd have told me, 10 years ago that I'm going to have to learn about lab-grown meat and how to farm crickets and all these other things, I would not have believed you. And I would have wondered how you came from the future. But anyway, that's a whole nother conversation. So the library is really proud to offer, in that vein, lynda.com, which is now transitioning towards LinkedIn Learning. It's a database that is pretty much whatever business skill you might need to develop, or whatever business skill you might be interested in vaguely, whether it's coding, whether it's learning how to write better, learning how to write on a deadline, which is something I kind of need a lot, which I talk to my communications director about a lot. But we're really happy to be able to provide that, and it's really thanks to the Grand Rapids Public Library Foundation Teich Fund that we're able to do so. So if you're interested in upping your skills, if you're interested in finding new paths of information that can help you be more effective, seek us out. We're at grpl.org or through a phone call. I know that's antiquated, but to your business librarian. So thank you very much and welcome. And I'd like to introduce Sarah from the West Michigan Sustainable Business Forum to kind of kick us off. So thank you.
Okay, hello everyone, and welcome to the March meeting of the West Michigan Sustainable Business Forum. I have to say I love the library, and I was just here yesterday getting some books, so hope everybody supports the libraries. They're really important. My name is Sarah Chartier. I'm a Senior Sustainability Project Manager for Spectrum Health and the Secretary of the West Michigan Sustainable Business Forum Board of Directors. The Board President, Steve Ramus, is traveling today, so you're stuck with me. So thank you to the Grand Rapids Public Library for hosting today's meeting. My organization, Spectrum Health, is proud to sponsor this month's event. And before we begin, a few updates and housekeeping items. First, and my favorite, is to recognize our new members: Commons Logic, Display Pack, Inhabitech, Grand Rapids Food Co-op, and Third Coast Test and Balance. And I believe Grand Rapids Food Co-op, we have Linda Jones here. Thank you. And Carol Hessel from Third Coast. Thank you. I'd also like to thank everyone who has renewed their membership this month. As there are more than 40 renewing members, we will not be recognizing all of you individually, so we can keep the agenda moving, but let's have a round of applause nonetheless. And a friendly reminder, if you've not yet paid your membership invoice for 2019, please do so. Membership dues fund the vast majority of the forum's activities, including events like today's. If you're not yet a member and would like to consider becoming one, now is the best possible time to do so. So please talk to Aaron, right here, or Dan before you leave today. Our next Grand Rapids Forum will be held Monday, April 8th at the Davenport University, and the program is being finalized over the next few days. So we're also hosting the Green Team Summit on Thursday, March 21st at the John Ball Zoo, Bizzle Treehouse. This event is a half-day summit for Green Team members and leaders within organizations where representatives will share best practices, key initiatives, and Green Team projects. You can find more information about the summit on our website or talk to the Executive Director Daniel Skudemaker. And he's in the back, if you don't know Dan. We're also in Muskegon later this month for a Sustainable Muskegon Forum, featuring a presentation from Meyer. So please check out all of our events at the West Michigan or WMSBF.org. So other housekeeping items, today's catering is from Daddy Pete's Barbecue, who's offering an all-vegan menu now, and that was delicious. I'm sure you're all enjoying that food now. All the food and foodware is compostable and can be disposed of in the bins with the compost signs. The bathrooms are located on the east side of the building at the stairwell, so just outside here. Please return your name tags. Do so and fill out the online feedback survey for a chance to win a gift card this month from Brewery Vivant. This month's winner is Patricia Chandler. Chandler? Oh, congratulations. And as always, receipts will be emailed to you within the next few days. So now I get the pleasure of introducing two leaders from Spectrum Health. Kevin Vos, the Senior Director of Hospitality Support Services from Spectrum Health Delivery System, and Dr. Kristi Artz, the Medical Director of Lifestyle Medicine at MedNow and the lead physician of the Culinary Medicine program. So they have been leading Spectrum Health as we transition towards more plant-forward foods and support local and diverse businesses. So I'm excited to bring them up here. Please join me in a round of applause.
Well, thank you, Sarah, and really just feel privileged to be in front of you today to talk around what Spectrum is doing around plant-based menus and education of how plant-based eating actually contributes to a quality of life, and really how we're putting that into reality, especially with the new market that we just opened. So again, my name is Kevin, and I'm here with Dr. Kristi Artz, and we're going to tag team this presentation. The title behind you is really just how we're framing the context of plant-based eating. And what I mean by that, well, before I get into that, our agenda today is going to be around who is Spectrum Health, just a brief reminder if you're not aware of who Spectrum Health is in the community, talking about the triple bottom line, and that's how we're really framing this context of plant-based eating to give us a framework to talk about. And then Dr. Kristi Artz will share the amazing work of standing up culinary medicine at Spectrum Health and the partnerships that all includes. And then we'll end with the new Michigan Street Market and Grill that just opened 7 days ago, which really brings a lot of these principles in light and just is, in my opinion, starting a new conversation in the Spectrum Health Medical Center community around delicious food that happens to be healthy. And support sustainability. So around Spectrum Health, just a brief reminder for us, really focused in West Michigan with our Helen DeVos service reach. We get a little bit outside of it. And with our insurance provider, Priority Health, we really cover the whole state. And just another form of context of who Spectrum Health is. We have a lot of accomplishments. The one that I think is most relevant to this conversation, though, is that with our merger with Lakeland Health on the Lakeshore, a little down south, we're a 31,000 employer group. And why is that important? That means that besides the state of Michigan, we're the largest employer in the state of Michigan. So whatever we're doing around focusing on people and celebrating diversity, or how we're looking at the planet and the health of our planet, or how we're looking at prosperity and supplier diversity and local investments, really has a large impact not only on our community, but it has a large impact on our employees, which make up a significant portion of our community. And to move to that triple bottom line, Spectrum Health uses the triple bottom line to frame a lot of our sustainability conversations, like many of you do. So I'm not saying this is anything new, but really looking at the people aspect, the planet aspect, and the prosperity aspect. And when we get into the people aspect, we're really, most of the work has been around standing up talent in very respectful ways and celebrating the diversity that's within those talent groups. So I happen to be privileged to lead around 1,200 entry-level staff, that we have done a significant amount of work around career certifications and career pathing to focus on. But also, this piece around people looks at how do we improve the health and wellness of our employees and of our community. And that's where there's such a strong tie in this topic today around plant-based eating, that we know the correct diet that's being recommended is so in line with how it actually contributes to environmental health. And that's really the neat intersection. And one of the things that I was really excited about, as Kristi and I were talking before this session, is that she really believes how can she as a physician care for her patients without thinking about the environmental health of our planet. And I think that that's one of the reasons I'm excited for her to get up and share her work, is because she is a physician that brings that perspective to our community. And I think that as Spectrum grows, we hope to engage more physicians in that conversation and that mindset. So the planet aspect of this is really around that interconnectedness of human and environmental health, which we all know that the plant-based diet really focuses on. And then prosperity. How are we, through our spend and our corporate social responsibility, affecting our planet in prosperity? So how are we buying local, and how are we actually supporting supplier diversity in our community? And I'm happy to say that we'll share some stories with the opening of Michigan Street Market and Grill that really highlight our move to ensuring that our food buy at Spectrum Health is focused on the prosperity of our community for that. And with that introduction and that framing of the triple bottom line, I'd love to introduce Dr. Kristi Artz to speak on culinary medicine at Spectrum Health.
Thank you, Kevin, and thank you, Sarah. I'm really honored to be here today and to have an opportunity to speak with you on this important topic and to share with you one area and one program that we've been able to kind of build from the ground up that really, I think, addresses that critical component of where healthcare systems, where physicians, where other healthcare providers can really be leaders in this effort to align what we do in patient care with what we do to be better stewards of the planet, essentially. I feel that in 2019, you really can't be a healthcare provider without considering the health of the planet. And I think food is one of those aspects. We all eat at least 3 times a day, so it's a really direct way that we can start to tackle some of these really important problems that we're seeing environmentally wise, that it certainly raise concern for all of us, but also opportunities. So I'm gonna start with a quick video. I think we're gonna make sure I get it loaded correctly. It's gonna just introduce the Culinary Medicine program. It's a 2 or 3 minute video, and then I'll give you a little bit more explanation afterwards. Here at Spectrum Health, we're working closely with our resident programs in internal medicine and pediatrics, as well as family medicine, to help them learn more about the direct link between food and health.
Blending the art of cooking with the science of medicine is very important because there's a lot of good research out there on the impact of healthy nutrition or better nutrition on health outcomes. But many healthcare providers have no idea how to work with that science of nutrition and actually translate it into healthy eating behaviors.
Students learn the nutritional science, they learn how to create healthy recipes, and they learn culinary skills. And when you combine the 3, they can really translate that into their home kitchen.
It's important to bring medical students into the kitchen to show them cooking skills so they can become comfortable and confident themselves. Once they understand how easy it is to prepare a healthy meal from scratch at home, they then can turn around and bring that to their patients and empower the patients to do the same.
When patients hear me talk more candidly about diet and nutrition, they're actually pretty surprised. Most physicians don't get a ton of formal nutrition education, especially after medical school, and they're surprised to learn that I'm very interested in helping them achieve a healthy diet and learn how to live a healthier life.
We are seeing and treating diet-related disease and really need to find an innovative approach as to how we talk to patients about food and its direct link on their overall health.
When we bring a medical student into the kitchen, what we show them is practical skills they can use not only at home, but by teaching them practical skills on food preparation, we teach them also how simple it could be to work with fresh produce and fresh ingredients and plant-based ingredients.
I have several patients and their parents who ask me questions in the office about healthy eating and how to incorporate healthy foods in their diet, and I knew that this would help me get there.
Eating better food myself helps me to talk to my patients about diet and nutrition because I'm a better example for them.
We're really talking about behavior change, which can be very challenging for patients, and we know that it's hard to make changes in our own lives. Our ability to talk to medical students and help change their behavior, they're then more likely to talk to their patients about it as well. I think gives you an idea of the program that we've been developing. That shows you the continuing education arm of the program. Am I back on the slides? Yeah, okay. Yeah, perfect. So, and I love it, Dr. Werner Absinger, who is the program director at the Sekia Institute for Culinary Education. I love that he calls everybody there a medical student, even though they're mostly practicing physicians in that case. But the program that we've been developing is really trying to take the science of nutrition and to pair that with skill development in a hands-on teaching kitchen, such that physicians can be giving more practical skills, more practical advice, really prescribing food when they're seeing and treating patients. And we're able also to extend that beyond just education for practicing physicians, and also how do we take that to our larger community and really talk about that direct link between food and health. As you can see at the bottom of that slide, we have many partners that have helped us develop this program, as I mentioned, including GRCC, who they've been a strong proponent of bringing this to the community, and other partners that they work with. Health Meets Food is our Tulane partner, so down in New Orleans, that's where a lot of the evidence-based curriculum has originated out of, and so we are one of over 40 national partners that have implemented this program locally. And then the downtown market with their great teaching kitchen space. So we have a multi-pronged approach, really starting first with medical education, reaching our medical residents, as I mentioned in the video here, so pediatrics, internal medicine, family medicine, they have all seen the real need that their residents have to be educated and trained around nutrition. The patients that they're treating in their clinics are usually suffering from diet-related disease, whether that's cardiovascular disease at more advanced ages, or we're even seeing, asthma or respiratory illness that clearly is impacted by the food and the environment in which we live and eat. We also have the continuing education program, so we're working with practicing physicians and other healthcare providers, whether it's clinical pharmacists, dietitians, that extended healthcare team, knowing that this needs to be a part of the ongoing conversation with inpatient care. And then lastly, community classes, which we've just launched recently, some of it grant funded through the Michigan Health Endowment Fund, to really invite people into that teaching kitchen space, to have physicians refer into that program. Again, I think it sort of elevates that conversation when your doctor is, prescribing a certain food pattern or a type of food that could be beneficial for your health. And why are we doing this? I think all of you in this room, I'm sure, are educated around the importance of food. I think more and more when you look at the nutritional science, it can be very complicated, or when you take a step back from it, it actually becomes quite clear that the patterns are all very clear and established as to what we do personally for ourselves to keep ourselves healthy is actually pretty similar as to what we could do to actually promote planetary health. And I believe that strongly. I love the way they phrased this in a Lancet journal article that was published in January of this year. And it was a commission of many, many countries around the world getting together and looking at what does a healthy diet look like, not only for the health of people, but the health of the planet. And clearly what we're doing right now is not that. This is the lose-lose diet. So we lose in terms of taking care of ourselves personally and our own personal health, and we also lose because it impacts the environment in such a negative way. So that diet, when it's comprised of mostly animal-based foods and otherwise then processed foods, we don't achieve health for anyone or our planet. And what does the win-win diet look like? Well, it's the exact opposite, essentially. I think Canada's new food guidelines is a nice visual that helps us to start to reframe what a healthy plate looks like. And as you can see here, it's a mostly plant-based plate. And certainly there are many indications that I believe strongly, and the science shows it, that if you implement a truly 100% plant-based diet, you can really even reverse disease. So how do we start to bring that into more of the conversation that we have with patients as well? So, and this is the reference diets that we should look to when we look to personal health as well as planetary health. And I think we're able to do that more and more when we bring this into the conversation, when we're talking with patients, and when we start to implement this more in what we're doing in our own healthcare system. And I know Kevin is excited to talk to you more about the Michigan Street Market and Grill that, as he mentioned, just opened last week. But it's amazing when you see the variety, the colors, when you see these delicious foods that someday, too, I hope that we're going to be able to see on the plates of our patients who are admitted, after a stroke, after a heart attack. That's where all of this needs to go, and we know that's going to support our community, our growers, and really, making us community advocates for the health of people and planet. So, Kevin?
So we had an opportunity to, the Prisms Cafeteria, has anybody eaten in the Prisms Cafeteria at Butterworth? All right. So when it was the Prisms Cafeteria, it was the busiest restaurant in West Michigan per annual revenue. It did almost 4,500 transactions a day and was close to a $6.5 million annual operating revenue. So we knew as we were thinking about how do we reframe this conversation around food and the impact that we could have by opening a new space, we knew we could have a significant impact just from those numbers, right? On the health of our employees and our community, on the prosperity of supporting local growers, right? So we had to take that very seriously. And we also did an experiment 2 years ago where we took the Prisms Cafeteria and we redid the first 400 square feet of it. We took an old salad bar and we moved the salad to the middle of the cafeteria so that it was accessible from both sides, which we felt like was good product placement. But then we took that old salad bar and we covered it with fresh fruits and vegetables. We also added in a lot of new open-air coolers, and what we saw, because we measured the impact of this, is that we used to sell 700 pieces of whole fruit a week, and that very quickly changed to 2,700 pieces of whole fruit a week just by that product placement and incentive by price. We also saw that same impact on sugary beverages because we added a lot of water products as well as a lot of non-sugary added beverages. And it used to be that 1 in 10 beverages sold out of Prisms was a non-sugary added beverage. And with our product placement, it went to 4 out of 10. So just by changing what we did, and that was 2 years ago. So we knew we could have a significant impact with the new Michigan Street Market and Grill. So we had to think a lot about, well, what is it that we're really trying to do? And we came to the idea that Michigan Street Market and Grill needed to be a restaurant that was that had whole foods in it, that were sourced locally and prepared fresh in our kitchens to nourish our body, mind, and soul. Or to think about it a little bit differently, we knew that this could be a space that if we cared about our employees and the people that ate here, we could produce delicious food that was healthy for you, and we could also ensure that all the meats were natural and antibiotic-free meats. If we thought about the planet, this was an opportunity for us to reduce our styrofoam footprint, right, on our community and go to all compostable products, as well as try to increase our local spend to 40% and that local spend defined by 250 miles of our location. And when we think about the prosperity, can we increase our supplier diversity through this initiative? So really quickly, this is what it looks like now when you walk into the lobby of Butterworth. And that lobby of Butterworth is actually the busiest street corner in Grand Rapids. There's over 10,000 people that walk through this. And you have this Michigan Street Market and Grill that the first 500 feet looks like the produce section of your grocery store. It's the cheapest priced avocados we have in town. And as we opened last week, everyone said, I just love the smell that happens when you walk into this store. And for those of you that are more business-minded, we don't have much shrink here because there's so much excitement around eating healthy. It's a different conversation that we started. If you go a little bit farther, we thought about the design, right? So we're promoting health. The next thing that you see is a large double-sided salad bar. On one side of the salad bar is your typical salad selections and toppings, but we're featuring a Michigan local lettuce grower at all times. That's an opportunity for us to educate our community and to start having a conversation around, where is this grower? Do you eat anything like this at your house? These conversations are happening with 5,000 people walking through the market every day now. On the other side of the salad bar, we have beautiful composed salads by our new chef, Mick Rickard, and his sous chef, Jim Cross. And this one behind me is a wonderful beet farro salad that has an orange-infused vinaigrette on it. And you can get a couple ounces of it, you can get a quart to take home, and we have 6 to 8 of these composed salads. This is a great opportunity for us to promote vegan and vegetarian dishes, right, and plant-forward dishes that look beautiful. This also gives us an opportunity really to partner with different local suppliers. So this is from our Artisan Deli. This is a vegetarian sandwich, chickpea sandwich that we're featuring. We're only using breads from Field and Fire, great local bread company. So that's just another aspect that we said, how can everything that we do in this market be different than what we've done before, and how can it be framed within that triple bottom line context, right? Just beautiful food, as Kristi said, it's colorful, right? We don't even have to promote it around the health of it because people want to eat it because it just looks so great. And lastly, I'll just touch on the supplier diversity side. And I know Creative Dining Solutions also has a relationship. On the left-hand side, this is Anu Sung. And how many, just for hands, how many know Anu at all? Anybody? So Anu is a Burmese refugee that came to this country in 2009. Ended up going to East Kentwood High School. Actually went through a lot of the entrepreneurial leadership and curriculum that they do out of East Kentwood High School. And Anu and her husband have been working in the commercial sushi business for the last few years of their life. But in last November, they started a wholesale sushi company, and it's rolling sushi with a purpose. So every tray of sushi that Anu sells, she donates a meal back to Myanmar in an orphanage that she grew up in. So we started last week, Monday, with 100 trays of Anu's sushi, and we were sold out by 12. We bumped that up to 250 trays on Tuesday. We were sold out by 1. She hires Burmese refugees in our community. She's going to hire 2 new Burmese refugees so that we can actually keep up with the demand of the sushi that's at the Butterworth Medical Center in our new market. It's just one representation of how we're trying to partner differently and use that corporate social responsibility and act like an anchor institution that we truly believe that Spectrum Health desires to be. So, in closing, we've created a space that thinks about food to thrive, right? We've created a space that partners with local farmers mostly working with Delbane or Ingerberg Farms that has a network of 120 farms across Michigan. We've really created a space that we can sell and promote supplier diversity. One example of that is Anu Sushi, but we're having multiple conversations right now in the community of how we can help and bring others into the market that we have. We've created a space that are looking at how can we promote things that are organically grown and natural. And we've created a space that really enhances our role as good stewards in the community. I'm happy to say that $6.2 million revenue source, if we continue the growth that we've had, we're up to about 5,500 transactions a day. We're on track to be a $9 million restaurant. All of those things are secondary to the conversations that we're starting. People are excited. People smile when they come in the space. It's obvious the impact that we all know food can have on people, the planet, and prosperity. So I just thank you. I'm sure that Kristi as well. Thanks you for the time that we have just to share a little bit about what we're doing to educate our community and how we're actually bringing that to life in the Michigan Street Market and Grill. So.
Okay. So thank you, Kevin and Kristi. Really inspiring. I hope you all will join us some point at the Michigan Street Market and Grill. Little plug, but it's really delicious food, and it's really exciting to be a part of that change. So next, please welcome Janine Oberstadt, Operations Director and Director of Corporate Sustainability for Creative Dining Services.
No. Good afternoon. Excuse the cough drop. I bet you all can relate. It's Michigan. So again, I'm Janine Oberstadt. I'm Corporate Sustainability Director at Creative Dining Services. And at Creative Dining Services, we are happy to call West Michigan home. We are a full-service food service and hospitality provider. And in these parts, we're very much known for our services on college and university campuses. But in reality, about 50% of our client portfolio is also corporate campuses. And so we do a lot of corporate feeding. Many of those Fortune 500 customers or Fortune 500 companies. And we also do some small regional healthcare and some senior living environment. We feed tens of thousands of people every single day. And traditionally, our vegan and vegetarian cuisine has been very, very good. And it's been all about feeding vegan and vegetarians. And we have been working hard on that to embed plant-based eating more deeply into our programming. So I'm going to tell you a little bit about that story and how we got there. So at Creative Dining Services, when our teams and our customers see the GROW sign, they know that means sustainability. At Creative, it's just our corporate marketing umbrella for all things green. And traditionally, vegan and vegetarian cuisine has fallen under sustainability, not culinary innovation. It's fallen under sustainability, like composting, because we were just targeting, we were accommodating. We weren't educating and advocating. We were accommodating diners that require plant-based eating in their daily lives. But we knew that there was a lot more of opportunity for that. And things, as they tend to do, started to change. We've always had the vegan and vegetarians. However, all of a sudden, the communities that we serve started becoming more diverse. Both our campus clients and our corporate clients started recruiting more from abroad, specifically West Africa and Asia. And so for the first time, we were often serving people that a large chunk of meat in the middle of their plate or the middle of their bowl was not only not familiar, but it wasn't even desired. But still, even with that growth, here was the real tipping point. We started noticing that more people were requiring plant-based options. They were asking for more vegetables, more fruit, less meat, and it was coming from meat eaters, flexitarians. And when surveyed, and we survey, when surveyed, boomers like myself cite health and wellness, maybe a little weight loss, and millennials and Gen Z cite in their surveys sustainability reasons, animal welfare, reduced greenhouse gases. Regardless, we knew that we needed to get our game on and expand. This was our opportunity we've been looking for to expand our offerings even further. And so, while all this demand was ramping up, about 2 years ago, we launched a program called Veg Out. And for us, it was an internal best practices checklist of how to take vegan and vegetarian out of the corner of our serveries, our cafes, and off the bottom of our menus, and integrate all kinds of vegetables and smart grains. When I say smart grains, I mean whole grains. Smart grains throughout at all access points in a cafeteria and all access points within a menu. It was also our first time of really taking a swipe at teaching our staff how to properly menu these items to give them more broad appeal. So you have vegetarian lasagna, or you can have roasted portobello and garlic lasagna. Which one sounds better? If you call something vegan, the vegans will come. If you lead with flavor in the title, on the menus, and at point of service, it sounds good to everybody. And it just happens to be plant-based. At the same time, we launched our Farmstead Program, which is our direct-to-farm purchasing program. This is purchasing outside of our prime vendor agreement. That's direct-to-farm. And here in West Michigan, we're incredibly lucky because of the biodiversity that we have. So this has been very, very fun, specifically for me, since I go to every farm and meet every farmer and vet the whole situation. But it's rules of engagement for both our teams who are purchasing and for the actual farmer producer. And the rules of engagement can be for the farm, it's direct to farm, farmers markets, CSAs, food hubs, and student gardens. And then on our side, at a corporate level, we vet certainly for food safety, transparency, accounting protocols. We are unique in that we do not haggle price with farmers. The farmer sets the price. It's our choice whether to take that or to leave it. So they are incentivized to give us their best price. And so we have currently 38 farms that we're engaged with in 4 states. It's been a very successful program for us, and it's growing. And at the same time, to sort of make a public statement and just to really put some teeth in it, we wrote quite a large section about plant-forward menuing and our dedication to it in our animal welfare policy that we published 2 years ago. And we asked the Humane Society of the United States to help us be co-architects of this policy, and they will help us update it every 2 years. But we are committed to serving both vegan and vegetarian at every point of service, at every location, at every meal. And that includes also alternative things like plant-based milks. So all of that programming helps support a variety of prescribed pathways and programs that our client communities that we serve engage with, including Healthcare Without Harm, Forward Food, which is actually a progressive plant-based food program of the Humane Society. We are members of Cultivate Michigan, so 20% by 2020. And for those of you that are familiar with college and university, the ASHE STARS program, which is a very progressive carbon reduction program for campuses. It's not just concentrated on food, it's campus-wide. And so there are very intensive, progressive, plant-forward requirements for all of this programming. And so our internal programs support this. But even with all this, we're feeling pretty good that our programming is solid. And certainly our vegan and vegetarian food is tasty, but we know still we're limited. How can we even go deeper with this? And the flexitarians, even though they've winked at us, we really think there's a lot more opportunity with meat eaters. Meanwhile, back at our corporate headquarters, our company is really investing in culinary innovation. Regardless of what kind of food you serve, it has to be delicious, and it has to look great. We eat with our eyes. So we've invested all kinds of resources in a culinary innovation council, in lots of training and development, keeping on trend with what Gen Z, millennials, and boomers want to eat. We've always had a strong team of registered dietitians that have supported all of our programming, but they were a little bit siloed too. They were in a support role, but there still was not, just a big strategy that was, there wasn't a lot of cross-pollination going on, let's put it that way. And then there's me over on the right with the recycling and the composting and the vegans, and just doing my thing there. And so again, we were asking ourselves internally, how do we take this to the next level? How do we have full integration between culinary innovation, really delicious food, food that's good for us, and also better for the planet? And we were looking for a sign. We knew that it was possible, but we just needed a little kick, a little shove, a little bit more inspiration. And then it came to us. Last year, several of us attended the Menus of Change conference. Menus of Change, if you're not familiar, is a partnership between the Culinary Institute of America, which is arguably the best culinary school, certainly in the country, if not the world, and Harvard's Chan School of Public Health. And they came to the table with a question. With all this research, with 30, 40 years of research around saturated fat, what livestock production is doing to the environment, what it costs to do this, triple bottom line, right? If we know better, how come we're not doing better? How can we engage the food service industry in this country to serve better, to menu better? After all, we're key influencers on what people eat. To say that we drank the green Kool-Aid at Menus of Change is an understatement. We came back pretty jazzed, and we hit the floor running. So we've taken our plant-based menuing and offerings, programming, we've revamped. And so we are at 2.0. We still have all of our vegan options and even more. We're training hard and fast with our culinary teams of not just making it truly vegan, but making it absolutely delicious and beautiful. Same thing with the vegetarian. But the tipping point for us, what's different this time around, is that we have engaged the central premise of Menus of Change, and it's called the protein flip. And it's going after meat eaters and trying to convert them. And the protein flip says this. Take that plate, as you saw in Chef Kristi's screen, take that plate and fill it with beautiful vegetables and fruits and smart grains. And then if you must, your meat, you want to use, how about meat is parsley? 2 ounces or less. You're using it for flavor, that wonderful umami, some texture, but you're relying essentially even on the proteins from the plants and the grains and the seeds. And then don't forget the seeds, full of protein, and all the wonderful condiments that are out there today, and that especially millennials and Gen Z love. We have huge condiment carts now. Every kind of sriracha and Korean chili sauce that you can imagine. And spice racks, which is something that we didn't even have in our serveries 5 years ago. Everybody wants it customized. And so this is, delicious food. And this hasn't been as hard of a push as you think. Our last 3 corporate concepts that were created for culinary deliciousness and how beautiful it was. For example, our Zatar concept, which is Mediterranean hummus bowls, or taqueria, which I can guarantee you is not your mother's tacos. Get roasted cauliflower and black bean tacos on whole wheat tortillas. other types of concepts that people are eating and only realizing after they've eaten half of it, I don't think there's any meat in here, but this is darn good. We're having a lot of success with this. And so that's what we've added, but what we're saved is truly triple bottom line savings. Saturated fat on the people's side, absolutely. Less meat, less saturated fat. Under menus of change, with that 2 ounce of animal protein at any given meal, red meat is recommended once a week, if. True reduction in red meat consumption. And for this reason, not only the saturated fat, but the environmental impact, the greenhouse gases that are associated with livestock production. The world can just not sustain this inevitably. I mean, or forever. It's just not going to happen. And then also potable water savings. Water consumption with livestock production is extremely high. And then the economic benefits just requires fewer resources to bring to the plate. It does wonderful things for our food cost. And that food cost savings, by the way, with our financial model at Creative Dining, does not go to our corporate coffers. It goes right back to our clients. So plant-based menuing, along with food waste management right now, are the 2 big inflation hedgers that we have, and they are incredibly effective. I hope to write a case study on 2 different college universities that are in our portfolio about looking at almost 11% savings in the first year of moving to more of a plant-focused menu. So quickly, how exactly are we doing that? For those of you that are in the food biz, and there's ways, I mean, there's lessons to take home with you as well to your own kitchen, is actually food mapping of serveries and menus, meaning be really, really thoughtful about where you're serving the vegetables and the smart grains, and then expand that. Putting this veg-centric menuing front and center, for us, taking vegetarian and vegan out of the corner of the cafe, out of the corner of the servery, and from the bottom of the menus, and getting it throughout. Market it appropriately. We're not calling it vegan lasagna or vegetarian lasagna or vegan stir fry. We're going to name it with the wonderful flavors profile of the dish. Reimagining salad bars is a big one for us. Lots and lots of legumes on the salad bar, lots and lots of nuts, lots and lots of seeds. Plant proteins, different types of tofu, seitan. And not all plants are created equal. Some have higher protein content than others, and we've gotten very good with mini posters and all types of educational offerings at our salad bars to help people make the right decisions. So again, expanded smart grains and nuts. Grilled vegetables on grill stations. Ever go to a grill station in a cafeteria or a servery? It's very brown and beige. There's lots and lots of opportunity. Why aren't we grilling asparagus along with the hamburgers? Portobello mushrooms. We had cauliflower on a grill the other day. Doesn't matter that you can walk over there and get it. This is suggestive selling. We have no problems doing suggestive selling with desserts in our industry. Let's do it with vegetables as well. Innovative pizzas, and this does not mean the obligatory mushroom, onion, green pepper, veggie pizza. I'm happy to say the last time I was over at Calvin College, we had roasted eggplant and garlic with broccolini, with sausage or vegetarian on cauliflower crust. So you could have it with meat or vegetarian. But when we do it with meat, we reduce that meat. More veg, less meat. Still get your meat, but more veg. Blended burgers. Blended burger project, cutting that animal protein with lots of different vegetables and grains. The James Beard Foundation has a nationwide blended burger project. And so that can be for burgers, meatballs, even meatloaf. Cutting out some of that animal protein and saturated fat and replacing it with high fiber, delicious veg. And here's where I'm big on vegetables at breakfast. Expanded vegetables at omelet stations. And I like side salads with my scrambled eggs or omelets. And the chefs told me the students wouldn't eat them, and they were wrong. Nice creamy eggs and a nice little tart salad with a vinaigrette. It's delicious. Been doing it in Europe for years. Vegan baking, which we are just getting our feet wet with. And at Kalamazoo College, when our baker Sarah puts out chocolate vegan cake with chocolate frosting, you don't even bother telling the football team it's vegan. It's gone. And of course, plant-based milks, which are extremely popular. So this is how we're doing it. And we feel like we're just getting started. But it's an exciting time, not only to have your eye on health and wellness and sustainability, but to be a cook, to be a culinarian, to be a chef. Because there's just a whole nother repertoire to take to the next level, and there's lots and lots of resources out there. So thank you very much.
Thank you so much, Janine, Kristen, Kevin. If you wouldn't mind joining us back up for a minute, we're going to have time for questions.
Hello? So the question is, how are we doing with the food the patients are getting? I will say that that is the area that we're expanding next into. We needed to create the connections with the suppliers that we had, and I would say so it's hard, we're a large corporation. I would say within 6 to 12 months, we will be expanding a lot of the offerings that you saw at Michigan Street Market and Grill to our patients.
I know I've been a bug in Kevin's ear, and I'll just add to that it's great that we've been able to collaborate, and I think that what we hope to see is that there will be plant-based menus, especially for disease conditions that require it.
Yeah. Is there a role of government in this process with reimbursements or authorization of costs or anything like that that needs to catch up to where you folks are?
Yes, the answer is definitely yes, but I think we are seeing traction in different programs that have been developing kind of throughout the country. One that we're actually going to be piloting around medically tailored meals, so it is another collaboration that we have through a grant-funded pilot program for patients with heart failure, and setting them up at the time of discharge to home with plant-forward meals that will be delivered in collaboration with Meals on Wheels. So how can we start to integrate all these networks and support patients after, a critical admission? And that can be reimbursable by insurance. That's happening other places, but that has to be discovered locally still.
It's a great question around the accessibility and cost of the food as we transition. And to hit a little bit, currently, food service in a hospital just gets lumped into the general room and board fee from our governmental payers. So whether I serve plant-based food or whether I served more traditional American diet food, I'm going to get the same amount of reimbursement for a patient being in the hospital. So there is a reality of the plant-based diet being more cost-effective, and there is a reality of the locally produced produce being more lasting longer. In fact, we had a great experiment of our chef taking some lettuce from an aquaponic farm in our community and keeping it for over 2 weeks and comparing it to the current lettuce that we were getting from our prime vendor, and it was unbelievable, the amount. So then let me talk, Wendy, just a little bit more about your accessibility. So we serve a vastly diverse group of individuals at Spectrum Health in that Michigan Street Market. So we were very conscious to expand the higher price point, but to keep the lower price point. So one of the things I didn't show you a picture on is our international station started off with Central American street tacos, had 5 different protein options. One of the most popular is a vegan chorizo plant meat alternative product. The tacos were $2 a piece, made in front of you, made a la carte so you could pick your toppings. We were very conscious, and surprisingly, everybody's got an opinion of food. I mean, that's what the three of us know. And we have not heard much about the price of the food in Michigan Street because, 1, it supports our vision. 2, I think there is something for everything that we're really conscious of that lower price point. And 3, it's just a different conversation because people are aligned with it, our community's aligned with it. In front? Sorry. Yeah.
Okay, sorry. Thank you for coming. It was all great and interesting. One thing I just want to share with everyone who may or may not be tracking the Farm Bill is there's a pilot program this year called Artisan Program, and it's a grant-funded program to get prescription for health programs throughout the country, which is, I don't know if you're aware of prescription for health. We have it. I run Holland Farmers Market. We have it at the Holland Farmers Market, but it's basically where doctors prescribe fruits and vegetables for those with chronic illness. But in the Farm Bill this year, this is something to put our voices into because they're going to be looking for feedback for funding for these type of programs on a more widespread level because they're all throughout Michigan and across the country and little pockets. But my question is, because they're on the Holland Farmers Market, how do you connect to local farmers and how can farmers and growers find you guys? And do they have to be GAP certified to sell directly to you?
Yeah, I'll start that one off. Can you hear me? Hello? Yeah? No? How about this? Okay, there we go. So as I mentioned through our Farmstead program, yes, we connect directly with local farms, farmers markets, CSAs. And so we have a proprietary vetting process, and so elements of GAP are required. We also accept group GAP. And so it is a combination score that I think is very unique within the industry, and I get asked how we do that math all the time, and I am not at liberty to say right now. But I will tell you that it's elements of GAP and group GAP, and then every farm that we partner with, is a full tour inspection. We really get to know who we're doing business with. And then there's some paperwork obviously involved, some liability insurance and things like that. So we have our own vetting process, and it's so far, it's proved very successful, for us. And we're big supporters of Michigan Ag, especially. I mean, we operate in 12 states, but Michigan's home, and we're big with Cultivate Michigan. We've signed the Michigan Good Food Charter, and so. And out of all of that, our Farmstead program was born. I just need Michigan's biodiversity in the other 11 states where we operate.
And just to add from a health system perspective, GAP certification is required for food that I'm feeding to patients. But in the Michigan Street Market and Grill, I don't need to adhere to that. So there's an opportunity there, a little bit of complexity to manage if we're going to, store food that is GAP certified and non-GAP certified. That puts me as a business owner at risk. So those are things that we're having conversations about. I would say while we've been in ideation around a lot of these ideas and working with the Culinary Medicine team for quite some time, this is a really new change, and it's nice to see it really supported from even our top CEO, and I think there's a lot of opportunity for us at Spectrum Health. I would ask that you have people connect with me, and we have a new chef that I could put people who are interested or growers that are interested in having conversations with Spectrum Health. Sure, at Revolution. Yeah, we're having conversations ourselves. You know Mick. Yeah. It is your delicious lettuce that I think we just started serving your lettuce last week, if I'm not correct. There was, yeah.
Yeah, so the question was around community culinary medicine classes. We do have a series of plant-based culinary medicine classes that are available to sign up for. It's really been a testing phase for us, which has been a lot of fun to see the excitement. And so we are doing a seasonal plant-based series. So we had a January and an April class. Those have both sold out. We have June and October upcoming. So if you could just go on the spectrumhealth.org, and then it's actually /culinary medicine, you can find out upcoming classes. Yeah. And all of our recipes are on there as well. Absolutely. I mean, I think we know the more greens, the better, however you choose to consume them. Certainly if we can chew them more than drink them, but absolutely. It's a great source of nutrition.
We operate juice bars, and sometimes in conjunction with our barista bars, and yes, wheatgrass is on the menu.
And we're having conversations right now with Jermal Eddy and Malamaya Juice Bar to really incorporate some of that juice into our Michigan Street Market. That's another connection which would bring the wheatgrass into our facilities.
Round of applause, please, for our speakers. So we have some presents for you. And I'm going to share a couple quick announcements as you come down. I have beer from Veg Out, as we often do. And then courtesy of our member, First Microgreenery, we have some, what do you call these, green pizza? Micro pizzas. So you can just pick those off and eat them. I was trying some on their back, and I ate them. They taste wonderful. They're microgreens, so please have at. I'm going to make some quick announcements, and I think they'll all be available for some follow-up questions if you would like to catch them on the way out. So again, thank you to Veg Out and Microgreens for our speaker gifts today. I'm going to be really quick. I don't want to keep anyone any later than we have to. If you have a cup of microgreens greens as a centerpiece on your table, please take those with you. You can either plant them or eat them. And if you have interest in learning more about microgreens and or wheat juice, please talk to Chris Hahn in the back here in the yellow plaid shirt. I wanted to give a quick announcement to a new initiative that we're starting up. As most people know, we accomplish our work through a combination of resource development, networking, and education. And a lot of that happens through committee-style working groups that we do either on a bi-monthly or quarterly basis that happen outside of these monthly meetings. So we're going to be launching one in the next month here, looking at the intersection of wellness and sustainability, something that we had called, at least at our board level, climate health for a while. And I've said often that I've been reluctant to start up initiatives based on some of these topics. And I think over time I've been worn down on these. And in particular, as we've seen more and more programming that talk about the importance of things like plant-based menus and relationship to environmental sustainability and climate change, and then just the growing recognition of the intersection between environmental health and public health. So we're going to launch this working group that is tentatively the wellness working group of the Sustainable Business Forum, and whereas we have some discussions underway as far as how to fully flesh out the objectives of that, we know at the very least we're going to be starting with conversations around plant-forward menus, around active commuting strategies, indoor air quality, and employee wellness, areas in which it have been pretty conspicuously proven to have an intersection of environmental sustainability and public health. And we're looking forward to forwarding some of those conversations in partnership with many of the other organizations we work with. And if you're not aware, we have several other working groups. And if you see anything on that bulleted list that strikes your interest, be it climate leadership or recycling, or the intersection of social equity and sustainability, please catch myself or even Sarah on the way out, and we would love to chat with you about getting more involved. Real quick heads up on our event next week. It's our Green Team Summit. If you haven't not familiar with this yet, we're still accepting registrations for another week. We're expecting a good crowd of 120 to 140 green teamers from local and Michigan companies, and that's going to be a fantastic half-day event. Also, to give a couple quick heads up, we'll be at Davenport University for our next meeting, Monday, April 8th, which will focus on stormwater management. And we'll also be in Muskegon later this month for a program on Meyer. And as some quick save the dates for some programming in which are not going to fall on the second Monday. Monday, June 17th will be on the third Monday of that month, which is our annual meeting. Wednesday, June 19th will also be on the Wednesday, June 19th will be, I wanted to draw your attention to that. That's a program we're having in St. Joseph, which is a tour of the Cook Nuclear Power Plant. Thursday, July 15th is also a third Monday, and that will be an extended program that will feature a tour of the waste energy facility and the Grand Rapids wastewater treatment plant / anaerobic digester, which are a block away from each other, and we'll have shuttle buses going back and forth. And then finally, on Wednesday, August 28th, we'll be moving from Monday to the Wednesday to accommodate the schedule of Patty Poppy, the CEO of Consumers Energy, a speaker we're very excited about.
She's a rock star, I'm telling you, you're like her.
And Dennis works for her. And please, thank you for coming today, and don't forget to leave your name tags on the way out.